So what does Meniere's disease, depression, anxiety, hiatus hernia, rheumatoid arthritis, Crohn's disease, what do they all have in common? Welcome back to my channel. I'm Joan Brown. I'm a Shaolin Qigong instructor, Tai Chi Chuan instructor, a Louise Hay, You Can Heal Your Life teacher, and a former psychiatric nurse. So all of those illnesses, Crohn's disease, hiatus hernia, depression, etc., they can all be helped or overcome by practicing Shaolin Qigong. So today I'm going to just chat to you a little about the students that I've had over the years that have overcome those conditions. In my very first class, that was 2001, September 2001, a guy named David came in and he had neck surgery. After the neck surgery, his right arm was paralyzed. And he came in and we were doing Lifting the Sky. Now, Lifting the Sky, I have already done a video on that, and I hope you're practicing it because it's a really, really good exercise. It's the whole session, not just the exercise, that makes the difference. Remember that. So he used to practice Lifting the Sky because he couldn't use his right arm. He used to have to pull it up like this. And then just let it come down. And again, he would help himself up and then bring it down. After 6 weeks, now he's in his chi flow where we let the chi run around the body. He used to sweat and sweat and sweat, and he was like he was shaking and shivering. After 6 weeks, he came in one night to me and he said, "Sifu, I held a cup of tea for the first time in a long time." So the chi had pushed through whatever blockage was there from the surgery, and actually he got his arm working properly again. I was thrilled. That was my first class, so I was really, really happy. In another class, I had a girl called, we call her Neve. The Irish students are a bit shy about about their good benefits from Qigong. So Neve had Crohn's disease and a very severe form of it as well. She was on steroids, but she actually had an adverse reaction to the steroids. But while she was on them, she was not doing too bad. But because she couldn't handle them, they had to take them off her again. So after some time, all her symptoms came back again. And one day she saw my advert in the paper for a 12-week course, and she came in and she had outstanding results. She knew the first night after doing Lifting the Sky that it had already had a benefit for her. And maybe one day I'll read out her whole testimonial because it's really, really positive and really good to hear from other people if you are suffering from that. Now, Peter, another one of my students, goodness, Peter used to come all the way from Galway down to Kerry, down to Tralee for classes. Anyone who has taken the bus from Galway down to Kerry know how long a trek that is, because you're usually waiting in Limerick quite some time. And it used to take him 6 hours. He used to stay over in Tralee and then go back up again the next day. And Peter used to suffer from hiatus hernia. And again, after his first class, he actually didn't take medication anymore after that. And after the 12-week course, he was fine. So that time I used to teach 12-week courses. Patricia, one of my Dublin students, she had rheumatoid arthritis, and actually another girl in Cork had as well. Both of those over the 12 weeks overcame their rheumatoid arthritis. Another young guy came in suffering from, he was very stressed, very, very stressed. He had high blood pressure. He was only in his 20s and he also was very depressed, and after some time, took maybe about 3 months of practice again for him, and he is a totally different boy today. I'm so happy with him. He did really, really well. I had another lady in a Cork class that suffered from Meniere's disease. She had had it for 17 years, and again after a 12-week course, she overcame it. These are real people with real problems. And I had another guy in a Cork class, John was his name, and he had been diagnosed with diabetes. Now, it took a while for that to clear, and I remember one day, it was well after the 12 weeks, or maybe about 4 weeks after the 12 weeks, and he was chatting to me, and he said, my diabetes is gone. So, and it has stayed, he's stayed perfect after that. So isn't that wonderful? In the next session, the next chat that I'll do, I will talk about my own journey going to Malaysia. I had a back injury, and I'll tell you all about that. But Qigong, Shaolin Qigong is excellent for chronic conditions, conditions that Western medicine can't really do much for. You're on medication, which is fine because it keeps you stable, and for most people they feel that's enough. But for anybody that really wants to get off medication bit by bit, then Shaolin Qigong is really, really good, and you really do need to practice twice a day. And that's all. The practice session is very short. It's only 10-15 minutes, and if you can't do that for yourself twice a day, well then, you deserve to be healthy, to be happy, and to be free. Now, if you want, just close your eyes for a minute or so. Just close your eyes and breathe. Nice, gentle breaths. In through your nose. We breathe out through the mouth because we feel there's more rubbish able to come out through the mouth than out through the nose. So in through your nose and out through your mouth. And just feel your whole body relax down. Relax your scalp and your forehead, and relax your jaw. Don't worry how, just tell yourself to relax. Relax the back of the neck and the shoulders. Relax your arms. Relax your hips, your whole back and hips down along. Relax your legs and your knees. And the most important thing, smile from your heart. A great big smile. Don't worry how, just smile. Good. And just allow the grace of God to flow through you. Just allow the grace of God to flow through you. Don't worry how or what it is. Just have the thought. Energy follows thought. Keep your mouth gently open. Good. Give thanks for just one thing from today. One thing. Doesn't have to be a big thing. It can be a small thing, it can be a cup of coffee, it can be your breath, your eyes, your hearing, your family, your kids, your pet. Good. And now, gently think of your dantian 2 or 3 inches below your belly button. Rub your hands together, warm your eyes, your face, back over your head. Very good. So that's one way to relax. I hope you enjoyed that. Now, if you want to subscribe, please do, or if you want to comment, or if you want to like the video, I appreciate all of those kind of things. I don't really edit these videos very much because I want to do it like I teach in class, and when I'm teaching live in class there's no editing, or if I'm on Zoom or wherever, there's no editing. So if there's some boo-boos in the middle of a video, please take no notice. It's almost like a live one. So take care of yourselves until next week, and smile from your heart, and lots of sudden joys to you as well.